So today we have Spencer Smith with us. He was born and raised in the peninsula, studied biochem in Southern California. He is the lab manager of Arcpoint Labs Monterey Bay, which provides the most comprehensive menu of laboratory testing and screening services in Monterey County. So a little bit about Artpoint Labs. Artpoint Labs is a full-service national third-party provider and administrator of accurate, reliable, and confidential diagnostic testing for individuals, companies, and legal and healthcare professionals. So in this talk, he will help people navigate the mandate executive order by addressing certain questions. And I'm pretty sure all of you have an invite with all the questions. And without further ado, Spencer, take it away.
All right, thank you so much, Jihan. I'm going to go ahead and attempt to share my screen. Like I was saying, I'm a bad millennial in that I'm not super tech savvy when it comes to all this. So how does that look?
Looks good.
Looks good. All right, perfect. Okay, so so thank you for the introduction. Again, my name is Spencer, and I am the owner, lab manager, and I'm giving the talk entertainingly titled OSHA COVID-19 Vaccination and Testing ETS, Everything You Need to Know. So thank you so much for joining me. It's going to be a great time. Let's just get started because there's quite a bit there. So I had a little self-introduction plan. Jihan did a great job, so I think we can mostly skip that, other than to say that we have some locations in Salinas and Monterey. Since the pandemic and since we were able to open in Salinas, we've actually done more than 30,000 COVID tests since that point. Very proud of that. I'm very proud to be here for our community, and especially here for our business members of our community as well. We actually started in kind of the for the business to business part, we started in drug testing, drug and alcohol testing, toxicology, compliance, and that sort of space around 4 years ago when we opened the business. And so that's kind of segued on, surprisingly, into how we approach these new emerging compliance issues with COVID-19 testing, also in the lab testing space. So, that is some of our experience and some of where we're coming from. Today we're going to be talking about the OSHA COVID-19 Emergency Temporary Standard. I'm going to be referring to that as the ETS pretty much for shorthand a lot. So if I say ETS, I'm just talking about this mandate that's being announced. I've broken it up into several categories. So a brief history of vaccines in the USA. That's the shortest part, just to give some kind of context for how vaccine mandates have been handled up to this point in the country. Then the bulk of this presentation is going to be about the vaccination ETS itself. So just going through actually what is contained within the OSHA standard, this proposed standard, the ETS. We're going to talk a little bit about the controversy. I'm sure everyone's aware of how it's winding its way through the courts right now. And that's an entire issue unto itself, not my core competency. I'm not, a lawyer myself, but have been following it closely, and I might be able to help answer some questions, about where the status currently is. I'm not going to be able to give you a whole lot of expectations for where it's going. My guess is as good as anyone's, but we'll at least touch upon that. And then creating an employer COVID-19 testing program. So I will also touch briefly on that. That is kind of my core area of competence. That's where I have the most information and I think the most insight to share. But it's also going to be something that will match employers specifically, their needs and questions they might individually have. So that's maybe a good place for Q&A, or also I'm always happy to talk one-on-one, at any point if any of you or anyone has questions about how that might affect their individual business. Even if we're not, doing testing for you, I'm still always happy to talk about the testing options out there. I've also listed down here at the bottom, I know it's kind of a mouthful, not something you can just control pace, but the primary sources here, it's always good to obviously read the standard yourself. And then there's also actually a congressional report, that was written for Congress to review the OSHA standard, prepared by OSHA, submitted to Congress, and that has a little bit more information about some of the topics. They expand on some of the things, so that's also a good one to read. So both of those links is a good primary source for reading what we're going to be talking about today. All right. So a brief history of US vaccines. So actually arguably the first vaccine mandate in United States history was 1777. So before we even had a constitution. George Washington actually mandated the smallpox vaccine for the Continental Army. They were fighting the British, obviously, and taking a lot of losses from smallpox. The very early stage smallpox vaccine was available at the time, and he mandated that every soldier in his army take it. That probably represents, the first vaccine mandate in United States history. More properly, because this mandate actually took place at a time when the Constitution was in effect in 1809, the state of Massachusetts mandated a smallpox vaccine for every adult member of their population. So it was an adult-wide, society-wide mandate by the state of Massachusetts specifically. At that time, just like today, that was controversial. Some people weren't happy about that. So about 100 years later, it made its way all the way to the Supreme Court, which in 1905 had this kind of a landmark case, Jacobson versus Massachusetts, where the Supreme Court essentially ruled that Massachusetts did have the authority to institute a wide vaccine mandate like that on every adult in the state, and that it's within the legislature's power, that there's nothing in the Constitution preventing a state legislature from passing a mandate like that. So by the 1970s, state mandates and vaccine mandates in general had become widespread enough that all 50 states had them in various forms and applying to various groups of citizens. So for example, there are vaccine mandates in the military, for schools, elementary schools all the way up to colleges, and then various like healthcare and other work settings, employer settings, where they've been mandated as well and continue to be so. 1970 was also the passage of the OSH Act, which established the Office of OSHA and the ETS, or the Emergency Temporary Standard. So it gave OSHA this power to issue emergency standards in cases, sorry about that, in cases where there was an immediate danger that needed to be responded to faster than the normal rulemaking process. And that is the authority that they used to issue this 2021 standard, which brings us to the 2021 mandate that was announced by OSHA at the direction of the Biden administration through the ETS. So that's just a whirlwind history there. And now we get into, really the meat and the real question, which is, let's go over what's contained within the OSHA COVID-19 ETS. All right, so it's actually a relatively simple and high concept what's going on, and I'm sure most of you are already aware of this, but I think it's still useful to just talk about in a nutshell, what is it trying to do and what is it actually mandating and who does it affect. So in a nutshell, all employers with 100 or more employees are going to be covered by this standard. And what it's requiring them to do is to make sure for every employee employed at that employer, that every employee is either vaccinated or is tested weekly in order to continue working. So they get a choice, it's vaccination or testing. So in some ways, it's been reported in the press a lot as like a vaccine mandate. That's kind of half of what it is, it's vaccine, or the other option is weekly testing. And that's basically, the main thrust of what the requirement is. Employers are responsible for compliance. The reason I kind of mention that specifically is that what it is employers are kind of the tip of the spear for implementing this, right? It's an OSHA standard, it's a workplace safety standard. So while employees are going to be required to take one of those two options, and there's some further wrinkles for certain classes of employees as well that we'll get into, the employers are the ones who are responsible for documenting that, for communicating and setting the policies and communicating those to their employees, for maintaining the records and providing those records for inspection by OSHA to prove compliance. And then employers are also going to be the ones who are held accountable or liable for potential violations. So employers really are kind of the nexus of this, what the Biden administration is doing, trying to drive vaccination rates throughout the country and choosing to use this instrument for that. It's currently being challenged to court, of course. Implementation date is uncertain. Whether or not it'll be implemented is also in some sense uncertain. So, and that's something we'll touch on later. But that really, at a high level is the entirety of this OSHA ETS. But of course, in the specifics, once you get to how it's actually put into effect, and of course, how it's going to be affecting your business specifically, there's more to talk about. So which employers does it apply to? Employers with 100 or more employees. That calculation can get complicated, for some employers who are on the edge or who have different arrangements with certain types of employees that they have. There are a lot of permutations for that. And the OSHA report to Congress actually gives examples for a number, like, what about independent contractors? What about a staffing agency? You have 80 employees, but you have 40 from a staffing agency. How does that count? In that particular case, if you only have those 80 employees, you're not covered. But the staffing agency that placed 40 employees in your business, if they've got 100 or more employees total, they are covered, even though they're working in the same workplace. Franchises is another wrinkle, right? Does a franchise or franchisee count separately? And they do for the purposes of this ETS. Seasonal employees, they count fully. Part-time and full-time employees all count fully. If you start with 103 employees when the standard goes into effect, and then you say drop down to 90 employees at some point because of seasonal variation or something, are you still affected? The answer is yes. So basically, the moment the ETS takes effect, there's a check done. Anybody who qualifies is going to have to abide by the ETS. If you increase your employment level to, bump up against it, you started at 80, and then later on, after the ETS has gone into effect, you hire enough to hit that 100 threshold, then you are also counted. So it's kind of a ratchet effect. People who start off being affected will continue to be so. And if you drop back down, below that level, you're still going to continue to be affected by the ETS. So it does not apply to a couple of categories of employers, specifically employers that are federal contractors or healthcare employers, so involved in healthcare that provide healthcare services. And the reason those aren't affected by this ETS is actually just that they are affected by an executive order and another separate OSHA ETS respectively. So they already actually are covered by a slightly stricter version in some ways of this policy, but technically are not covered under this ETS. Okay, so that's what employers are affected. So employers that fall into that category do have to worry about implementing this OSHA standard. What employees within each employer does it apply to? So it applies to all employees that are employed, except there are some exceptions, of course. So having an ADA qualifying medical contraindication, just meaning that there is a documented medical condition or concern that the ADA is going to cover, that means that they're not going to either be eligible for the vaccine or that for their health reasons, they're going to want to delay or perhaps not be vaccinated. So just like doing other ADA determinations, this is kind of something that's implicated in other human resources issues. So it's a similar process there, often involving a medical professional's attestation. But those ADA qualifying medical contraindications will mean that those employees can choose not to be vaccinated and not covered. Have a genuinely held religious exemption. So another similar thing, language like this exists in other areas of law and regulation, like for example, with dress codes and things like that. So genuinely held religious exemptions are those that the employer has no reason to believe are held in bad faith, so like an employee who all of a sudden expresses a religious, alignment that has no history, that doesn't appear to be sincerely held, that there's no evidence that they actually, have those religious beliefs, but they're choosing it because maybe it aligns with something, a belief that they currently hold not to be vaccinated for another reason, like, personal or political reason or something like that. Those are not necessarily exemptions. So just because somebody expresses that, oh, this is against my religion, it has to be demonstrated to be a genuinely held religious exemption or religious belief or practice. So those two are exempt an employee from being covered by the vaccine mandate portion of the ETS. Those who work from home are another category. So somebody who exclusively works from home, an employee that exclusively works from home, does not need to be vaccinated and does not need to be tested. However, if that person works from home most of the time, but is occasionally in the office to participate in a meeting, to fill out paperwork, to pick some paperwork up or something like that. If they are going to be in the office for the period that they're going to be in the office, they will have to submit to the testing if they're not vaccinated. So, at some point prior to coming in for that day's staff meeting, if that's once a month that they do, at some point in the prior 7 days, at some point in the prior week, they will have to be tested in order to comply with the ETS. Work exclusively outside is another class of employees that are specifically carved off as having other considerations in this ETS. So employees like, for example, maybe construction, tree trimmers, somebody who is going to spend all of their time outdoors and all of their work and responsibilities can be done outdoors. They do not have to be vaccinated or to be tested. Now, if there are some activities that take place indoors, like they have a 10-minute meeting in the morning and that takes place indoors, they are no longer considered an exclusively outdoor employee. They, any job responsibilities that have to be done inside, turns that employee into an indoor employee, or at least not the exclusively outdoors, meaning that they're going to have to be covered by the ETS as well. But employers are allowed to, if they can, adjust how those employees carry out their duties, so that if they can make it so that everything happens outdoors, say move that morning meeting outdoors, or have paperwork at the end of the month to just handle that outdoors. Whatever, if you're able to make that adjustment, then those employees can count as exclusively outdoor. But they do have to spend all of their time, and all of their work responsibilities have to be able to be discharged without being indoors with other employees. And then the final thing is employees that opt for weekly testing, of course, do not have to get the vaccine. All right, so like I was saying before, it's a vaccination or test mandate. So employees that aren't in one of those exempted categories are going to have to choose one of these two options. They either have to get vaccinated or they get to get tested. You don't have to make the decision to be vaccinated immediately. It's possible an employee could be tested for a while and then decide to become vaccinated. But at all times, they're going to have to be in one of those two categories, and they're going to have to remain compliant in one of those two categories, which means if it's the weekly testing, of course, that means, it's a continual thing that's constantly being updated. So for the vaccination, there is a provision in the ETS stating that employers must provide paid time off in their policy, and their COVID-free, company policy must allow for up to 4 hours per shot paid time off in order to receive that shot, because now that this vaccine is being required as a condition of employment, that means that they need to be compensated for their time that they need to do to actually receive the vaccine. So up to 4 hours per shot. In a case where it's a 2 vaccine series, so like Moderna, Pfizer, then they are required to get that time off twice for each particular dose. They're also required to have follow-up time off if there are side effects or symptoms that appear after vaccines, as they may happen in some people, that they feel prevent them from coming into work or functioning in the workplace, then there's additional time off necessary that you're going to have to address in the company policy as well. At this time, there's no language about booster shots. They specifically mention 8 hours as being the cap for the amount of time, paid time off being granted to employees. The booster vaccines, have kind of risen to prominence since that ETS was originally released. So, that could change in the future, but at the moment, booster shots aren't covered and aren't required to be covered as paid time off. But of course, a company can always choose to do so. This isn't, something that prevents an employer from taking that step. Now, when it comes to vaccination, employers do have to be able to document which of their employees are vaccinated, because obviously if they're vaccinated, they don't have to be tested. But in order to be compliant, those vaccinations for each individual employee have to be documented. So the documents that work for that are the employees must be able to provide either a vaccine card. It's pretty straightforward. A vaccine record from a healthcare setting. So that would be if they got vaccinated at CVS, they might have given them a receipt or a document, something like that, that showed that they were vaccinated at this time at this date at this location. State issued document of vaccination. So there are state documents that the state can issue, but in California especially, we also have those scannable QR codes. Those do work so long as they are scannable and you can verify that scanning it leads to the state document proving vaccination. It matches up with the name and the personal information of the person who's presenting the QR code and so on. But assuming that you can get that, then that does count as well. And then there is actually a fourth option, which is employee attestation. So if an employee got vaccinated, say they might have been vaccinated in their state. They might have been vaccinated here in California, but no longer have a vaccine card. And maybe they say they're not able to access the QR code and they're not able to look it up in the state system. They can just sign an employee attestation, and that is enough. However, the employee attestation has to include specific language. That language is actually laid out verbatim in the ETS. Just warning the employee that misrepresenting or falsifying information or providing falsified documents is a criminal offense that can include time in jail as a punishment for that. So, but assuming that they're able to sign that attestation, then that also works as a document. And then any of those documents, they do need to be maintained as personal health information by the employer for every employee, that's in their organization, and those need to be available for inspection by OSHA within 1 day of a request being made. Okay. Now, for weekly testing, that's the other option. So those employees who choose not to be vaccinated, then they're going to be on the weekly testing plan. So weekly testing just means they need to provide a negative COVID-19 test every 7 days in order to be, participating in the workplace. Again, this isn't counting those exempted employees. However, there's two categories of the exempted employees we talked about, which are the employees who have a medical or who have a sincere religious belief that exempts them from being vaccinated. Those two groups of employees will still have to be tested every week. So just because they have an exemption for the vaccine, great, that means they don't have to get vaccinated, but they still are going to have to be tested because they're an unvaccinated employee in the workplace along with other, employees and customers and so on. So they are still going to have to be tested. The one difference for those groups is because they have a legitimate exemption, normally an employer and insurance company is not required to pay for this testing. Because the employees are given the option of being vaccinated instead, the employer under this ETS is not required to pay for the testing, the weekly testing that employees go through in order to continue to work without being vaccinated. However, if it's an exempted employee, an employee who has a religious or an ADA exemption, then it's a little bit fuzzy on that, but the interpretation right now is that because those are valid exemptions, and an employer is required to make reasonable accommodations for those employees to continue to work and execute their duties. One of those reasonable accommodations is likely to be providing that weekly testing. So that weekly testing in that case would be likely, it's prudent to pay for that for those employees as part of the reasonable accommodations made for allowing them to continue to work. All right, and then I believe I mentioned it before, but remote employees who come into the workplace, infrequently will need to be tested for those periods where they're going to be in the office with other people or interacting with customers and so on. All right. Oh, and then I should mention once more that these are all of these records do have to be maintained. So you're going to need a negative test, on record for each employee for each week's period in which they work. And that those are also treated as personal health information. So HIPAA protected personal health information, which just has a higher standard of data security and retention that needs to be followed in order to be HIPAA compliant and compliant with this ETS. All right, and then finally, for those who choose not to be vaccinated, there is a mask mandate included in this ETS as well. So those who are not vaccinated are going to be tested weekly, and they also have to wear a mask when indoors with other employees or other individuals, other customers as well, or in a vehicle with other employees. So if they're going to be in a vehicle driving around, they're going to need a mask on for the duration of that trip. These masks are also not required to be provided by the employer. That's some language that's contained within the ETS as well. So I've already gone into documentation, and I think it's just important to keep reiterating how important it is. And I think that's familiar for anyone who deals with OSHA or works in the HR setting in general. But still, to reiterate, there is a lot of documentation that is required by this ETS. So first and foremost, a company COVID-free workplace policy, basically a policy that is written by the company. That is compliant with the ETS, so it covers the key points and requirements of the ETS. It explains how the company is going to be compliant with all those points, and then is of course made available as part of like the employee manual or made available for review for all of the employees before being implemented. All right, and that's something that the ETS requires and couldn't be inspected by OSHA. Documentation for each employee's vaccination status. We covered the kind of records that are qualified for that. Documentation for each weekly test performed. Reporting any hospitalization or deaths due to COVID. That's a term that's placed within this ETS that has been in place before. That's not really new, but any employees that are hospitalized or that become deceased due to a COVID-19, along with a COVID-19 diagnosis are required to be reported to OSHA, even if they're not exposed in the workplace. So just employees that have that diagnosis that then have one of those two eventualities occur, those are reportable to OSHA. And then all of these records have to be available by request for OSHA. They say by the end of the next business day, or may be counted as a violation. Actually, the COVID-free workplace policy, I believe, is 4 hours, has to be provided within 4 hours of a request from OSHA. All right, and then there is some other language that the ETS requires. So this is particularly in communication with employees. Employers are required to have this policy that is compliant with the ETS and to communicate that policy to employees, to disseminate the CDC document, Key Things to Know About COVID-19 Vaccines. It's an informational pamphlet that the CDC published, and that has to be available for employees. Anti-retaliation and whistleblower protection, so information about the anti-retaliation whistleblower protection provisions that OSHA already has, those are already required to be posted, but it's specifically called out in this federal OSHA ETS that those be communicated to employees. And then information about criminal penalties for knowingly supplying false statements or documents. That is also the same language that has to be included for, you know, those employees signing an attestation that they were vaccinated, just informing them that, you know, supplying a false vaccine card or a counterfeit vaccine card or lying about your status are considered criminal penalties. All right, and speaking of penalties, so that's the penalty side for employees who misrepresent. What about for the employer side? What's the exposure to penalties for noncompliance? So these OSHA violations can run $14,000 per violation, meaning that can be, you know, for different areas within a workplace that might not be compliant. It could be different offices, you know, within a single employer that aren't compliant. Those might each count separately as a separate violation. So if they're found to be in violation, they might compound in that way. It could be for separate incidents. So if, you know, one location has a recurring issue meeting compliance, those might, you know, different incidents could be counted separately. Even individual employees that are not brought into compliance through negligence or just, you know, poor paperwork or something could be counted separately for each employee. $14,000 up to $14,000 per violation. $135,000 for willful or egregious failures to comply, mostly covering cases where OSHA determines that either it was willful, you know, that they were attempting to just ignore, evade, misrepresent compliance, or that they were notified that they have, you know, completely aware of what they would need to do to be compliant and have not taken any action. Those would be that would fall under the egregious failure to comply. There's also potential whistleblower, retaliation, and negligence charges that could be asserted by employees. So an employee, if they assert that not only is a workplace not compliant, but they believe that the workplace was, you know, harming them, being negligent and putting them in danger by doing so, then they could separately, you know, file those charges. And then there's one other wrinkle to be calculated into this risk assessment process for your company, which is that in the Build Back Better legislation, there is language in there instructing OSHA to increase OSHA penalties by up to 10 times in the coming years in order to drive revenue. So there is some you know, language in current legislation that is basically instructing OSHA to be a lot more aggressive about these kinds of fines in the workplace. That the Build Back Better legislation isn't specifically referring to this ETS necessarily, but talking about fines in general, driving those up by up to 10 times in the coming years. So that's something that probably should be taken into account when performing these kinds of risk assessments for how to move forward at this point, and then obviously based on how the outcome of various like legal issues that we'll be getting into soon. So that is a real, you know, it's a kind of a dive into the language and all of the requirements of this ETS. They're obviously, you know, I did my best to cover as much as I could, but, you know, once you get down to the level of an individual company, there are going to be potential wrinkles and questions. So hopefully if there are some of those, I can answer those in the FAQ portion. But I want to move now on to just a brief foray into the controversy and the court cases around this ETS and what its current status is right now as we're talking, which could be different by the time, you know, we log off and we go and check the news. These things are moving quickly. As I was preparing this presentation in the last week, every single day I've had to go on and, you know, make changes or make notes to myself about things that have been cropping up in various courts around the country. But as of this moment, the ETS was challenged by over 24 states and various other entities as well. Around the country, those were consolidated basically into one case as kind of a time-saving, like a standard time-saving measure for when cases like these come up. And then due to luck of the draw, it was referred to the 6th Circuit Court of Appeals, which is based in Cincinnati, Ohio. That's where it currently is. That Court of Appeals then issued basically an injunction pausing the implementation of the ETS, and OSHA then announced shortly afterward that they would comply with the court's injunction. And so at the moment, it's basically in limbo. Originally, it was announced on November 5th to be taking effect on January 4th. Pending the outcome of this case, it will not be, the ETS will not take effect. So until this court case is decided, the ETS is just suspended and won't take effect. Now, obviously, if the court decides against the ETS, then at that point, you know, presumably then it would never be implemented at all, except that likely and almost certainly this is going to be appealed to the Supreme Court after the Sixth Circuit makes its decision. So whichever side loses in that particular court case is going to appeal it to the Supreme Court. It's up to the Supreme Court whether they take that on, but it's widely expected that they would. And then so the Supreme Court likely is going to have the final say on this particular legal issue. In terms of time frame, which I believe is my next slide actually, but it's anyone's guess how long that may take. The Ets Authority, so the Emergency Temporary Standard, and that's what the authority given in the original OSH Act in 1970, which gives OSHA the ability to make these emergency rules. The Ets Authority has been used 11 times since 1970. Of those 11 times, several of them were challenged. 4 of them were actually vacated by a court after their announcement. So 4 of them were blocked. 1 of them was partially vacated, so partially blocked. So basically in the 11 times that it has been used since 1970, 5 of those times, almost half, courts eventually struck down the requirement in part or in whole. I don't know how much predictive ability that gives for this particular case, because this case obviously is unique and different than the cases that came before, but it does give you an idea that, this is not it's not certain in one way or the other. Timeline of implementation for this ETS. So like I said, it was originally announced on November 5th. The employers were originally supposed to have a policy drafted by the 5th of December. And then the standard would have been instituted on the 4th of January, 60 days following the announcement. It's currently on hold, and that's uncertain what the time frame for implementation is. But the Biden administration in the meantime has appealed directly to employers throughout the country and asked them to begin applying their vaccine mandates even before the actual OSHA standard takes place. So basically, they've requested to employers saying, this is going to be in limbo in court, but in the meantime, you do have the power to institute your own mandates that will eventually align if and when the standard actually is put into legal effect. And they've asked employers. There's no binding aspect to that request at all. Obviously, that's just something that they've gone out and kind of promoted in order to try and drive adoption. But it is something that they've done, and some employers have responded to that, or at least perhaps have begun planning for the eventual implementation of the ETS. So there are a number of employers throughout the country who have their own versions or their own vaccine mandates for employees. Some of these, like especially the airlines, actually predated the announcement of the ETS by quite a bit. Some of them have happened since. And in a Bloomberg poll of executives at companies who would be covered, so with 100 or more employees, 25% of companies polled by this Bloomberg poll are already implementing mandates or in the process of implementing mandates that would be compliant with the testing and vaccination ETS. All right, so from the employee side of things, this is an SHRM, so Society for Human Resources Management. 42% of employees support their employer for enforcing this federal mandate. 42% support it. 39% of employees object to their employer enforcing the federal mandate. Depending on what poll you look at, it moves a little bit around there, but the basic story is very similar, which is just that it's very divisive, and it kind of splits both employers, employees, and others and observers in terms of supporting or objecting to the mandate. So I think, in terms for legal terms, obviously this doesn't change if it comes into effect, employers will have to comply. But in the meantime, I think it informs messaging strategies. It informs how employers should approach, even in the planning stages, how it's important to be both communicative, but also to have a strategy for how the communication happens. Like, for example, a lot of employees might be under the impression from news that the mandate has already been struck down. I think it's important to set the expectation that it has not, that it's just pending court decisions right now, and so on. So that strategy has to be informed by the fact that there's a lot of emotion and a lot of opinion on both sides of the issue. So will it be enforced? I think that's the $1 million question. And that's where my crystal ball fails me. My crystal ball has been unreliable at best in these past 2 going on 3 years now with the pandemic. And I don't have much better idea than anyone else. But what I think is that it's prudent to, I guess we can go back here. It's prudent to do the contingency planning, right? You don't necessarily have to go the full 9 yards and implement the entire strategy, but understanding the ETS itself, understanding how it affects your business, the employer that you work with, and understanding what measures would need to be taken in order to fulfill that ETS. That's a great first step. And then a second step is to be doing doing those steps that you can do to lay the groundwork, which we'll get onto in a moment. I think another part of the risk assessment is going to have to be the fact that federal OSHA is not the only office that has the ability to issue safety standards. So there is a Cal OSHA, so the California OSHA office itself does have an ETS on COVID-19 that covers employers in California. It is not a vaccine mandate. It's a much more limited testing ETS that I'm sure everyone has seen and digested already. Basically dealing with things like symptomatic employees in the workplace outbreaks, when they require employers to cover testing for their employees and things like that. So that is an ETS that is currently issued by Cal OSHA. However, Cal OSHA will at some point, or would at some point, assuming that the federal ETS goes into effect, be responsible for putting their own version that is at least as comprehensive as the federal version into place. And using that as a template, they may decide to go out ahead of the federal OSHA again, which is what they did when they issued their first emergency testing temporary standard. It's conceivable that they might also issue a standard that covers in part or in whole what the federal standard is currently attempting to do. And being a state regulation, it would be under a different set of legal exposure than the federal one. It could be implemented separately. And then, of course, there are separate requirements for federal contractors, healthcare workplaces, and it's conceivable that other standards might be put into place for other segments of the employers. Of note, last night, the federal contractor mandate was actually stayed by a judge in Georgia. And that was just last night as I was going through things for this. So, these things are moving targets. They're changing all the time. So understanding how they're evolving is going to be, an ongoing endeavor. And then there are the emerging local mandates. So like New York City, which was in the news 2 days ago. So another slide that I had to amend for this, issued their own mandate, which is actually more restrictive than the ETS. That obviously doesn't directly affect us here, but it's a precedent. So in that mandate, they required all employers to require all of their employees to be vaccinated. So it's going to be a shifting mosaic of requirements, and the fact that some of these requirements can come in without necessarily the federal ETS being put into place, and then of course also the possibility that the federal ETS is found to be sound by the Supreme Court and allowed to be put into effect. That's also going to be a possibility. So all of these things just increase the that side of the risk calculation for laying the groundwork for compliance with those kinds of regulations. So that's this next slide, what's next for employers. If you're subject to the OSHA ETS, as I've been saying, it's probably prudent to lay the groundwork to achieve compliance, but you may wish to delay major initiatives during the limbo period. So until it's known, one way or the other, you can do the groundwork without having to completely initiate the entire policy. So for example, gathering information about employees' vaccination status. That's something that can be done without necessarily having to go the whole 9 yards and implementing a mandate in response to that information. Establishing compliant written policy is definitely probably something, an exercise that a lot of employers are going to find to be valuable. Establish a protocol to evaluate exemptions and religious exemptions. So there's probably analogous procedures at a number of employers already for things like, dress code or something like that. But having a specific protocol in place for how to figure out, how to evaluate those claims from employees is going to be something that if this ETS does get put into effect, that'll save you some time in order to catch up to compliance at that point. Provide information and PTO to employees who may decide to be vaccinated. So you can, there are steps that can be taken to improve vaccine uptake among employees without having to actually have a mandate as well. And providing PTO and communicating, providing information and that sort of thing is just a couple of ways that can be done. And employers may consider whether prioritizing that kind of thing might actually help them later on pay dividends, having kind of a slow rollout before a mandate actually has to take place. And then preparing a testing solution and protocol is probably a good idea. So again, this doesn't have to be implementing a testing protocol, but preparing one, knowing how it's going to work, knowing how the records are going to be generated and stored, knowing who's responsible, for paying for it, like the employee versus the employer, knowing if it's going to be required for employees to, to seek it out themselves, or if it's going to be something the employer arranges with a vendor ahead of time. Those are all going to be important decisions that can be discussed or made and put in place before actual testing protocols are implemented. So that's the controversy, and that's the contingency planning that's being done. I did want to cover some of what's in my specific wheelhouse, which is the testing programs themselves, and specifically what kind of tests and what kind of solutions are provided for in this ETS. So on that topic, so as I was saying before, COVID-19 testing, employers and insurance companies are specifically exempted from having to pay for these tests. So that means that the employee can be responsible for their testing if they decline to be vaccinated. That means that the employer could decide something as simple as saying, you have to show up every Monday or every Wednesday, or once every 7 days with a negative result in hand. We'll put that on your file, and then you're good to work. They can be as hands off as that. It could also be something where the employer procures or helps direct employees to a particular solution, or puts a solution into place but asks the employees to pay for it, or of course there's always the option the employer could just have a testing program that they pay for, although that is not required in the ETS. Where is it done? So there are a couple of options actually. So employees, again, can be an arm's length kind of thing where the employer simply requires that employees have a negative test result for every week that they're working. COVID-19 testing personnel can also come to the work location in order to have, say, like 1 day per week where rapid tests are done, and every covered tested employee at the work site is then cleared for the following week at that point. And then there are home testing options. So home tests, those tests that you can get over the counter and then perform yourself, a self swab and a self test, those do qualify for this ETS. However, they cannot, there are some limitations on that. There's another slide where we'll talk about that, but basically an employee can't just, say that they went home and took one and then come into work and say, yeah, I tested negative. There has to be a third party or an independent person who reviews their test, who observes their test and observes the result in order for that to count for this ETS. Documentation reporting, which we've covered before. This is all personal health information. So it is covered by those regulations regarding to the confidentiality of personal health information. And all test results must be retained by employer for the duration of the ETS. That's another challenge facing, for example, a home testing protocol where employees just take the test at home. The documentation does have to be generated, and it does have to be something that can be retained and shown to OSHA as proof that these negative tests were performed properly. And that can be a little bit more challenging in a home testing context. And all of these records have to be retained and then able to be provided to OSHA within 1 day of a request. So that at-home test. So again, if an at-home test is taken and used to qualify for the weekly test, it cannot be both self-administered and self-read. You're going to need someone like a telemedicine proctor, an official from the company who's able to observe, when somebody swabs themselves and performs the test, so that it's being done correctly and that the result is being read correctly and recorded, or of course by a healthcare professional. So a healthcare professional in any other kind of setting is able to also observe, interpret the results, and then generate the paperwork for that. Advantage of home tests is that they're low cost. The one disadvantage is that they are relatively low accuracy, and that applies in both directions. So there are concerns for false positives. Obviously, that can be a challenge in a context where you have a lot of tests happening on a weekly repeating schedule. A false positive test in that context could be concerning and could be challenging, because then you'll have people who are worried, but not necessarily worried about exposure. You'll have somebody who's not available until, maybe for that week, or until they get another test, a backup test is not available to be at work. So the disruptions coming from that are something that should be accounted for when creating a testing program. And then the method of generating result documentation can also be a challenge, as I mentioned. There are lab-based tests that are available as well. These are some of our technicians at our Salinas laboratory. I just slipped their picture in, but the lab-based tests have some advantages. They have higher accuracy, so lower chance of false positives, lower chance of false negatives. You don't want false negatives either, obviously. And then they can be done at the clinic. So, at a clinic location, at our location, at a urgent care, at a hospital, anywhere that these kind of tests are offered, it can be done, or as a group at the place of employment. So as an on-site type opportunity. Another advantage of going to a lab-based test or a lab-based vendor is that they may have a variety of tools to fit various needs. So sometimes you're going to want, the quick and easy rapid tests, but sometimes when you get a false positive on that, you're going to want a backup that returns results quickly, but has a higher degree of accuracy. Sometimes, for example, when you have a patient who might be exposed, maybe in their family and is having symptoms, you might opt for a more sensitive version of the test as opposed to one of the rapid tests that have lower sensitivity, because you want to help, you want to minimize the chance of spreading that infection at work and minimize the chance of, having other people having to take time off. And then the results are typically generated, reviewed, reported, and in a form that's conducive to keeping on file when you get a lab-based test. But those are all options that employers will have in order to meet the ETS. And like I said, false positives, all tests have the chance of error. Rapid tests, especially the rapid home tests that are going to be self-administered and then to some extent self-read or at least processed by an individual employee, are subject to the highest rate of false positives. Often the false positive rate for a laboratory-based test is going to be in the order of 0.1% or so. Home tests can be a couple of a percent to 1%. Not especially high, but in the context of an employer who has, maybe a dozen employees or more testing repeatedly over the course of several weeks, you're going to be expecting to see a few of those false positives show up at some point. The ETS actually makes specifically calls out confirmatory testing as a way to, not have to send someone home when they have, say they have no symptoms. There's no reason to believe that they've been exposed, but they have this positive test on one of these little cassettes. Then you can overturn a potential false positive by testing on a nucleic acid amplification test, such as PCR. So these are the more sensitive versions of the test. Some of these tests are available with a quick turnaround time as well. So you could have, potentially an employee who tests false positive in the morning, but is able to overturn that, within a couple of hours and still be able to work for that week, putting everyone's mind at rest on that topic. So that is something that's specifically covered in the ETS as well. Unfortunately, you're not allowed, maybe not unfortunately, the testing protocol that they outline there does not allow you to take, say, an antigen test that comes back positive. So you take 2 more, they're both negative and say, okay, those antigen tests, best 2 out of 3. That's not approved. It has to be an NAAT or like a PCR test in order to overturn an initial positive test. All right, so thank you very much. I really appreciate you staying with me for that presentation. I know it was a lot and that it's coming at it from a lot of different angles, and a lot of you probably know a lot of this information, but I hope there was a little bit more information there for you. I did want to have some time for FAQ. I don't even know, I timed myself earlier, but I feel like I was going a little slower this time. Yeah, sorry about that. But I will try to, do we have any questions, any time for questions?
Yes, we have 2 questions in chat. Before we get to chat questions, we do have someone on the phone. Christy, do you have any questions you want addressed? It seems like she's not responding. So yeah, let's get into the question chat. I'm sure you've already addressed these, but let's go over them again. Let's see here. So Larissa asked, what about proof of booster after proof of vaccination for retaining records?
Okay, so at this time, there's nothing requiring that the employer tracks booster, the status of a booster vaccine. That again is something that I think with recent events like Omicron, the Omicron variant has come around, and the booster vaccines certainly existed, but were more of an optional thing when the original ETS was published and written. And since then, it's been emphasized a lot more. by the Biden administration, by public health organizations. So I think it's reasonable to presume that at some point, assuming the ETS is put into effect, that boosters as well might be enter the equation somehow. So I don't know if it would be a bad idea to maintain those records, and you're certainly able to maintain those records. There's nothing stopping you. That's not information that you're not allowed to collect. But as of this moment, as it's currently published, there is no mention of booster shots, and they specifically refer to a completed course of vaccine as being either 2 shots or 1 shot. So the language that they use basically considers a 2 shots of Moderna or Pfizer to be a complete vaccination, 1 shot of Johnson & Johnson, and just doesn't have in those guidelines any mention of the booster shots, and doesn't consider them to be part of a vaccine, like a complete vaccination. So there are no current requirements for keeping those or reporting them, but it's probably just like a lot of this stuff is kind of risk assessment and planning for the future. I think it's possible in the future that some of those might be important to gather, especially now that today we're seeing evidence that Pfizer is saying that their booster shot improves the defense against the Omicron variant. So as things like that start coming out, there might be some pressure to expand that requirement.
And you did address this in the last few slides, but Melissa asks, are there specifics on type of test that has to be used? Can an at-home rapid test be used instead of a PCR test that can take a few days to get back?
Yep. So hopefully I answered that question for you. The requirement that in the ETS is just that it has to be an FDA authorized or approved test for COVID-19. So it has to be, it can't be something that hasn't gone through the FDA emergency use authorization process. But any kind of commercially or available lab tests out there are going to have gone through that process. You want to be careful that you're not getting some kind of imported, especially if you're doing home tests or something like that. There are vendors who will sell them from overseas, maybe even factories that produce these that haven't gone through the US process, but maybe gone through a European or an Asian process. I mean, that's theoretically possible. I've seen a lot of those tests out there, but honestly, if you're going through kind of a reputable source, then you're going to have a test that qualifies for the ETS. And so that includes home tests, that includes rapid antigen tests, that includes PCR tests and things like that as well. So those can be done. But I think, it's likely that just for cost reasons, for turnaround time reasons, it's going to be highly preferenced for these kind of routine tests to be the rapid antigen type tests.
Okay. So the next question is from Nicholas. Will the Zoom recording and slideshow be made available to us attendees for future references? The Zoom is being recorded. The slide.
Yeah, I'm happy to make the slides available. And then also I'm always happy to answer questions one-on-one as well. So if anybody wants to get in touch with me, but I can, can I make the deck available to you and you could?
Yeah, then I'll send it over to everyone else.
Perfect. Yep.
All right. And Gabriella asks, is there any way that reference links, ETS links can be included in the chat? What you do is send over an email to everyone that came by today, along with the slide that there will provide to me.
Yeah, and I can copy paste those, I think, into the chat right now. Sorry again about my relative technical incompetence, but I can at least just copy paste. I can do that. All right, so I hope those links work for everyone, and you can also just Google search them to find them. But yeah, those are the primary source. So you'll see the actual text of the ETS as well as the report to Congress explaining and kind of it just expands on a couple of the requirements there.
All right. Well, that concludes today's Lunch and Learn.
All right. Thanks, everyone.
Yeah. Thank you for joining us.